Welcome back to the Best PT Podcast. This is episode 4.2, talking about pulmonary anatomy and physiology. Pulmonary musculature, the muscles of inspiration. We have the diaphragm, which increases longitudinal diameter of the thorax. The intercostal muscles, both internal and external, elevate the ribs, which increases both the transverse and anterior-posterior diameter. And we also have accessory muscles of inspiration. The sternocleidomastoid, or SCM, scalenes, the sternocostal head of the pectoralis major, pectoralis minor, and serratus anterior. These are used during high-level ventilation. And the muscles of exhalation. Exhalation is usually done by passive recoil with quiet breathing, but forceful exhalation is done by the rectus abdominis, the obliques, and the transverse abdominis. Respiratory tracts. The upper respiratory tract consists of the nasal cavity, the pharynx, and the larynx. These humidify and cool air as it enters the body, as well as help filter air through nose hair and mucous membranes. And the lower respiratory tract consists of the area from the larynx down to the alveoli. And remember that the lower respiratory tract divides 23 times between the trachea and the alveoli. The lungs. Lung lobes. The right lung has 3 lobes, the upper, middle, and lower lobe. And the left lobe has 2 lobes, the upper and lower, as well as the lingula, which is considered to be equivalent to the right middle lobe. Bronchiopulmonary segments. The right lung has 10 and the left has 8, starting with main bronchi that descend into lobar bronchi, or bronchi of the individual lung lobes, into segmental bronchi, bronchioles, and then terminal bronchioles. The alveolar capillary units. The sinus is the respiratory unit of the lung. Also pronounced asinus, although that makes me laugh a lot, so I prefer echinus. Oxygen diffuses at this unit across the alveolar capillary septum into the red blood cells, and carbon dioxide comes back over through the same mechanism, diffusing from the blood to the lungs in order to be exhaled. The visceral pleura are the membranous sacs that covers each lung. And the parietal pleura is membrane sacs that cover and line the inner surfaces of the thorax. Pulmonary neurology. Remember that breathing is kind of weird. It happens both through the autonomic nervous system as well as voluntarily. So right now, as I'm talking about breathing, you're probably thinking about your breathing and you've switched from autonomic to voluntary control. The respiratory control center in the brainstem integrates information from both central and peripheral chemoreceptors and mechanoreceptors. These respond to increases in partial pressure of carbon dioxide by increasing ventilation, as well as peripheral chemoreceptors respond to low oxygen levels by increasing ventilation. Lung volumes and capacities. Anatomical dead space volume is the volume of air occupying non-respiratory airways. Expiratory reserve volume, or ERV, is the maximal volume of air that can be exhaled after normal tidal exhalation. So breathing out and then attempting to breathe out a little bit more maximally. This is 15% of the total lung volume. Forced expiratory volume, or FEV, is the maximal volume of air exhaled in a specific period of time, usually measured in 1, 2, and 3 second intervals. Forced vital capacity, or FVC, is the volume of air expired during a forceful maximal expiration after a forced maximal inspiration. So breathing in as deep as you can and then forcing out as much as you can after. Functional residual capacity, or FRC, is the volume of air in the lungs after normal exhalation. So this is the combination of the ERV and the residual volume, and should be about 40% of total lung volume. Inspiratory capacity, or IC, is the maximum amount of air that can be inspired after a normal exhalation. This is measured as tidal volume combined with inspiratory reserve volume. Inspiratory reserve volume, IRV, is the maximum volume of air that can be further inspired after normal inspiration. So breathing in normally and then attempting to breathe in as much more as you can. This should be about 50% of total lung volume. Minute volume ventilation, VE, is the volume of air expired per minute, defined as tidal volume multiplied by respiratory rate. Peak expiratory flow, PEF, is the maximum flow of air at the beginning of forceful expiration. Residual volume, RV, is the volume of gas left in the lungs at the end of maximal expiration. This is about 25% of total lung volume. Tidal volume is the volume of air inspired and expired per breath during quiet breathing. This should be about 10% of your total lung volume. Total lung capacity, TLC, is the volume of air in the lungs after maximal inspiration. This is the sum of all lung volumes, so residual volume plus vital capacity. Vital capacity is the change in volume between maximal inspiration and expiration. This should be about 75% of total lung volume. This can be calculated by taking tidal volume, inspiratory reserve volume, and expiratory reserve volume. That's it for episode 4.2, Pulmonary Anatomy and Physiology. The next episode, 4.3, will talk about cardiovascular pathologies. As always, the outline will be in the show notes. Thank you for joining me.